Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Welcome back to Season 2 of In the Ladies' Room with Dr. Donica. Today I am so excited for our guest. To kick it off, we are going to talk with noted sex therapist Dr. Shannon Chavez about the sex talk you never had. And I am going to tease you until we get to the topic and she can tell you what it's all about. Dr. Chavez is a licensed clinical psychologist and a certified sex therapist specializing in the treatment of sexual disorders, sex education for conservative religious and cultural groups, and out-of-control behaviors surrounding love and sex. So we're going to talk about that too. She's the clinical director of SHAPE, which stands for Sexual Health and Pleasure Enhancement. That center is in Beverly Hills, California, and she provides couples and individuals with therapy, sex and relationship coaching, and workshops on sexual health and wellness. Dr. Chavez believes that the heart of sexual intimacy is connection. I believe that too. Her work with couples focuses on adult sex education, integrating sexuality and spirituality, sexual discovery, and personal growth. She also specializes in the treatment of sexual trauma and abuse and what she calls love addiction, as opposed to sex addiction. Dr. Chavez has written a guide for clinicians on the treatment of love addiction using attachment-oriented therapy. She frequently appears on national news, radio, and media as a sexual health expert, and I had the pleasure of doing a media tour with her several years ago on menopause and sex. I love what she says, of course, in general, but in particular, how she starts off her intro on her website, drshannonChavez.com. Easy for me to say, drshannonChavez.com. And I love this quote, and you said it years ago, whatever statistics you've read about the prevalence of sexual dysfunction, forget them. This is the only one you need to remember. 100% of people have had sexual concerns at some point in their life. So with that introduction, please help me welcome Dr. Shannon Chavez. You are in the ladies' room.
Hi, I'm so excited to be here. Good to see you again.
It is great to see you again. So tell me first, before we get into the good stuff, how did you decide to become a sex therapist?
The magic question here, people are always curious. You know, it always felt like a natural fit. I feel like from a very young age, I was very comfortable talking about sex. And I actually started my career going into medicine, but found out that I was more comfortable counseling. And then when I found out that sex therapy was an actual career, I never looked back. I thought that's exactly what I want to do.
So and who told you that secret?
You know, I had some really amazing mentors. I had a woman that taught human sexuality who's still a really good friend and colleague, and she just inspired me to want to help people around sexual health. And I also was surprised to find that in grad school, not a lot of people were interested in working with sexuality, yet wanted to work with marriage and family therapy. So I thought that was definitely an area that couples are going to need support. And, you know, sexuality is how we all got here. And it's the one that we all have in common. So people really need to start talking about it.
Absolutely. In fact, I went to the medical school I went to was one of the first medical schools to have a unit in sex and sexuality on the curriculum for medical students. And I think it was only 12 weeks. Once a week, but you know, it was very influential. So that was really great. Anyway, so tell us how you got this focus on religious and conservative groups.
Yes. So, you know, I grew up in a conservative Catholic household and I'm a Latina. And so sexuality is not something that was openly talked about, especially in my culture. There's a lot of stigma and taboo, not only around sex, but also around therapy, actually going to someone and addressing issues. So for me, I find that that's a big barrier for a lot of people coming from conservative cultures, talking about sex, having the right tools to do that, and feeling comfortable about it, and understanding how sexuality and spirituality are connected. So what I kind of do in my practice is help people understand that they're very much alike. You know, who we are sexually has a lot to do with who we are spiritually, whether that is religious beliefs or just how you live your life. So I think integrating that for me is really important, so people can break down that barrier and know that sexuality is an important part of health and well-being.
That is great. And how is that message received by those by people in those groups?
You know, it took a while to develop a style that was going to be okay for people coming from different belief systems. So I call it non-pornographic sex education. So how do you learn the ins and outs and the how-tos and intimacy skills where it doesn't feel pornographic, where you can get good information and learn anatomy and physiology without feeling like it's going to be something outrageous that's going to be against sort of your belief system. So I had to really develop a lot of tools, even teaching tools. As a sex therapist, I use a lot of visual tools, a vulva puppet and wooden models, things that can help people understand how sex works, coming from different backgrounds.
You know, it's funny. I do a weekly Facebook Live video. And one day I was discussing my pet peeve, which is when people refer to the vulva as the vagina, which just drives me crazy. So I had done this interview.
You and me both.
I had done this interview where the reporter asked me very good questions about the issue of shaving your vulva and shaving pubic hair and all kinds of medical questions related to proper shaving and waxing and everything you ever wanted to know. But then the title of the article when it came out was, is it okay to shave your vagina? And I was just like, no, there's no hair in the vagina. You cannot physically.
It's not a vagina, yes.
So I called up and I demanded that they change the title of the article, and they wouldn't change it because they said, well, we know the difference, but we think people just use that term to be all encompassing. And I was just so frustrated. But anyway, so I was addressing this on my Facebook Live video, and all I used was a graphic of, you know, a cartoon with the parts labeled. It wasn't even an actual human. And Facebook would not let me promote the episode because they said it was pornographic because of that one graphic labeling the proper names for the anatomical parts of the female genitalia. So we still have a long way to go with that.
We have such a long way to go, and especially social media, it serves the purpose of educating and providing good information. And if they're going to be policing something like anatomy and physiology, that's, it is a real issue. We do have a long way to go in that sense.
Maybe they were rejecting it because it wasn't pornographic enough. Anyway, I love the connection between sexuality and spirituality because what it's about is connection, you know, and it's about that deep connection that you feel to something other. But anyway, let's jump right into the topic for today, which is, I love your title, The Sex Talk You Never Had. So what is this?
So, I feel like everyone had a talk or maybe some sort of talk, and I think of my own experience. I remember how uncomfortable my mother was talking about just general puberty and things going on and menstruation and things that are a part of sexuality, even outside of sexual behavior. So I feel that a lot of
How old were you when she did the talk?
Let's see, I believe I was probably a freshman in high school. And the talk was, she actually had tears, so it was not a comfortable talk. But I feel like this is a shared experience. A lot of the clients I work with have the same experience. I didn't get a talk, or I didn't get a lot of good information. So it brings up the topic for me of, where do people get information when it comes to sex? Where do they learn the skills and tools around sexuality, whether it's what we're doing sexually or even communication, how we talk and assert ourselves around sex? So the Sex Talk You Never Had is a combination of skill building and communication skills, and also sexual health being an aspect of self-care. I know self-care is a big topic, and people are always addressing that. What is self-care? Am I doing enough for self-care? So I like to integrate sexual health into self-care and talk about what that is and how it can be a part of overall health. And it's something that you can do to take care of your sexuality, which is a nice surprise for many people.
Okay, so talk to us about self-care.
So self-care, the first thing I do with self-care is define it. What is it? It's not a to-do list. It's not things that we're checking a box. I think that self-care is anything you're doing intentionally for your overall health and well-being. And it's going to look different for everyone. I hear a lot of people feeling embarrassed around their self-care. I'm binge watching The Real Housewives, or I'm, doing something that isn't productive. And sometimes there is guilt around that. I'm not being productive enough in my self-care. So I like to change it to something that you're doing intentionally for you. It's designed by you for you. And when it comes to sexual health, self-care is being in touch with your body. Especially as women, our sexuality is changing constantly. Our bodies are changing constantly. So we have to have a good connection to our bodies and be able to know what our body needs, whether it's rest or pleasure or touch, being aware of what that is.
My body always seems to need massage.
I don't blame you. I think my body is.
That's number one on my to-do list.
Yes, touch, massage. Massage is a great form of self-care. And I think people need to give themselves permission to pamper their bodies in that way. It feels good to relax and massage and just have even a day out where you're going to a spa or going and doing something for yourself. I think the rituals around self-care are great for mental health because there's a routine and habit around taking care of you, which becomes more of a priority the more you do it, which I think is great.
So then connect the dots for us between self-care and sexuality.
So I think for a lot of people, when I see them in my practice, they're either dealing with desire issues or libido issues, or they're feeling very disconnected from sexual health or sexuality in general. My pleasure is not where I want it to be. I'm not in the mood. So I bring in self-care as a first priority. Before we can address what's happening in a relationship or with a partner, we have to address what's happening with your relationship with you. I always tell women the longest relationship you have is the one with your body. So what's going on in that relationship?
And often the most self-destructive relationship you have is the one with your body.
Yes, mind, body, heart, and spirit, right? With the things we tell ourselves, the way we feel about our bodies, and all the mixed messages.
Talk about our bodies.
Exactly. The negative talk that we may not even be conscious of, but we're looking in the mirror and starting to evaluate or criticize our bodies. So the first step in sexuality, addressing sexual health, is looking at self-care for your body. And maybe that's, some of the exercises I recommend for women are walking around in the nude. Being in a natural state, it doesn't necessarily have to do with anything sexual or anything other than just being in touch with your body and being able to look at your body as a whole. And so that's where we start with connection. Let's start with you developing a healthy relationship with your body. I'm also looking at what you're eating, what your lifestyle choices are, and how that's impacting sexuality, because that has a lot to do with how our body is functioning sexually, and bringing that into awareness, I think, helps a lot of people make better choices.
Okay,
I'm
so
not eating regularly.
For people between what they eat and their sex life. So where's the connection there?
Well, I always think of libido as life force. So it's not strictly sexual. It's basically our energy that we put towards things that we desire. Sometimes it's work or family or sex or relationship. So when there's libido issues, I'm always looking at food. What are you consuming? Are you feeling a lot of fatigue? I find that my female clients that are dealing with a lot of fatigue are also dealing with libido issues. So we're looking at just developing a healthy lifestyle around food, being conscious around what you're eating, being mindful about eating, taking your time and nourishing your body and being mindful in the experience of it. And of course, exercise, taking care of your body through exercise, and not just going to the gym, but just being outside and taking walks and feeling your body move. Sometimes I recommend dance classes for some of my female clients to get in touch with their libidinal energy, which is a great way to say, okay, this isn't sexual, but I like the feeling of it. It makes me feel sexy, or I feel confident when I'm dancing.
Mm-hmm. Now, of course, as a physician, when I hear fatigue, I want to talk about sleep.
Yes.
So, many times when I'm hearing about women talking about lack of desire and fatigue, I can answer that in 1 second when I say, what's the average number of hours of sleep you're getting a night? and they're
Yes.
tired. And that's another one of these just kind of answers. But we have a real sleep deficit. So many of the women I talk to want to go to bed, but they want to go to bed to go to sleep. So how do
Right.
you address that in this whole construct?
So I think with sleep, one of the things I see with men and women in my practice is that they are taking on too much.
Mm-hmm.
So they have full calendars, engagements, events, things going on in their lives. So they're not really prioritizing self-care. They're feeling obligated to have a full calendar and all of these things going on. So sometimes it's about permission to let go of pleasing others or having to always be busy. I think even the idea of rest and getting good sleep requires good habits and rituals. So sometimes we
Absolutely.
start with sleep hygiene,
Mm-hmm.
with unplugging before you go to bed, no devices. I think that's a big problem too. We're always connected, and so that's a stimulating source of always being connected and alerts going off. So I try to create an environment in the bedroom that promotes relaxation, sleep, and sex. So I always say there's two things going on in the bedroom: sex and sleep.
And not necessarily in that order. Sometimes you need to sleep first and then have sex, which for a lot of people is a good solution, especially if they're really tired or if they're on different work schedules or if they have a new baby or, all those issues. So I think, or do you see with your patients that for many people who have this go, go, go kind of lifestyle when they're overcommitted, do you think they become sort of get to the point where they view sex as one more thing on their to-do list?
Yes, absolutely. It's a task, it's a chore, it's something that they have to do that feels like an obligation, or to avoid conflict in a relationship. So it creates a different sort of motivation. I call it an averse motivation. They're doing it to appease a partner or because they feel they have to, and there's no play or pleasure in sex. So that's usually the first step is, how do we bring in more play and more pleasure that doesn't feel like work? And that may start with different activities, trying to do things that are not the norm in the routine in the relationship.
Such as?
Sometimes back to touch, something as simple as eye contact and touch. I always recommend engaging the senses. So that may be listening to music. Music is something for most people that can evoke a positive emotional response. It also makes you want to move your body and maybe even sing and be vocal. So it does allow you to get more in touch with your senses and sensual self. So it may start with small activities like that. And what I do is eliminate the idea that sex is a goal or sex has a certain outcome, and build a mindfulness in.
Is this with your male and your female patients?
Oh, absolutely. Everyone gets the same
The same talk.
skill set. Yes, absolutely. Because I think mindfulness is something we hear a lot about, but a lot of people say, well, what is that? Is that meditation? Is it breathing? What does it mean? What does it have to do with sex? How do I apply it? So I always say mindfulness is just slowing down and being present with whatever you're doing: eating, sleeping, talking with a partner, even touch. I think even touch, we can be in our heads. So it's about learning how to let go of the idea that there's something to do and just enjoy.
Well, and I think it's learning about getting connected to somebody else's pleasure being integral to your own pleasure.
Yes.
Which means you have to actually think about the other person.
Right. And it doesn't have to be the same. I think sometimes even with desire issues, we have to have the same desire to have a compatible sex life. I hear that question a lot. Are we incompatible because we have different interests or different desires, or we're just completely on a different page when it comes to our sexuality? Absolutely not. I think every difference can be acknowledged and supported in a relationship with the right communication.
So don't you think that at the end of the day, that's really what people are coming to you for, is validation? And, many times I find that people just want to know if they're normal or not.
Yes.
I talked to a patient who I'm going to do a podcast episode with in an upcoming episode, who had a labiaplasty, which is, labial cosmetic surgery, when she was very young, because she just felt she wasn't normal down there. And she just speaks about it so openly and candidly.
And I was struck by the fact that when I was her age, it never occurred to me that I wasn't normal down there. But this was something that was really, really important for her. And the only way she could get validation was to like take these photographs to a plastic surgeon and try to look like these pictures. And then of course things went really bad. So do you work with people who've had surgical repairs and injuries and physical trauma as well? And what are you hearing from them?
Absolutely. I've worked with women that have had surgery and then have had some negative side effects like losing pleasure, or they're contemplating whether or not surgery is going to help them feel more confident in their sexuality. And, genital shame happens, I think, regardless for a lot of women because they are, again, back to the sex talk. They haven't actually seen genitals other than their own. They don't know what is normal or if there even is a normal. And it's hard to talk about it and feel comfortable with their genitalia. I also work with women that have been shamed by partners around their genitalia, which is definitely a trauma. And so it's rebuilding that confidence and knowing that that was not an appropriate way to communicate in a relationship, and that definitely affects how she feels about her own body.
So one of the questions I get from a lot of my listeners about sex therapy is, how do I know if I should go to a sex therapist by myself or with my partner? And then of course, the flip side of that I hear from a lot of women is I want to go to sex therapy with my partner, but he's not interested in going. So how do you address those two questions?
Those are great questions. And usually if I meet with a couple first, I'll recommend meeting with them individually so I can get a thorough assessment of their own sex history and to look at what their goals are individually before bringing them together as a couple. Now, if a partner's not coming to therapy, I think that addresses a bigger issue in a relationship. What's his or her resistance, or what's happening in the relationship where a partner doesn't want to commit to that change or addressing some of those concerns. And I think that is a bigger picture issue for a couple. And I think it's also knowing what is sex therapy. I get a lot of questions around that. Are we going to be putting out a lot of fires? Are we going to be focusing on an affair that happened 5 years ago? There's a lot of questions about what will be addressed. And I usually tell people it's very specific around what's happening in your sexual health. So if you're coming in as a couple, we're addressing not only what's going on for you individually, but how that's impacting the coupleship. And so it's specific and it's more short term than traditional psychotherapy, which is looking at past issues and relationship styles. We're looking more at specifics around what's happening with sex. And if we have to look back into the background of the individual or attachment styles and such, we will. But it's more, let's look at what's happening right now in the present and how we can address and support that.
But of course, things that have happened in the past influence greatly, either consciously or subconsciously, what's happening in the present. I would imagine the scenario
Absolutely.
you brought up about somebody having had an affair 5 years ago. Are you ever in the situation where people choose to reveal that in the safety of the therapeutic relationship, just so that you can kind of be there as a referee or moderator to kind of help that confession?
Yes. I usually set up those ground rules for any couple starting therapy. There are no secrets. If there's something to be disclosed, we plan out that disclosure. Now, of course, disclosing an affair that has been kept secret for a while in the relationship requires having a disclosure that makes sense for the coupleship. What do we want to communicate? How do we want to address this? What is our intention with disclosing something like this in couples work? So it's planned out, and it's definitely something that we're collaboratively working on with with the intention of the couple improving and growing and healing from whatever rupture the relationship has experienced.
So in your experience, do most couples that you deal with actually heal from that? Or is that often a catalyst for a divorce or a breakup?
It's probably 50-50. It really depends on the couple. I've seen some couples grow through it, move past it and heal, and end up on the other end stronger than ever because through the process they've developed really great communication skills. They've addressed some of the sexual issues that weren't being addressed before, and they've come out with a lot stronger relationship than when they started. And for others, it's a value issue. It's betrayal is a value that cannot be healed, and it definitely creates rupture in a relationship. So it depends on the individual couple and also how long they've gone without addressing it. I've seen some couples wait for years and years, and there's been so much damage at that point. They've disconnected and completely grown apart, and have already made up the decision in their heart that the relationship has ended.
Now, have you ever had this situation where somebody planned out this whole disclosure only to find out that the other person had also had an affair that they had not disclosed?
I haven't had that situation, but I have heard of that situation often.
So what are some of the more unusual scenarios that you've had to deal with couples?
I think with couples, for example, fetish behavior, something that is very taboo and not talked about. So I may have a partner in couples that has a fetish. So a fetish is any desire towards a behavior that arouses sexually. It can be an object, it can be a certain act, and maybe they are feeling embarrassed about it. So I've had them bring it into therapy and talk about, how do I address this with my partner? I want to explore this, but my partner isn't aware of it, or I feel shamed by talking to my partner about this. So they're looking for ways to communicate and find ways to exercise that desire in their relationship. So it's their fetishes are very common, but I think they're also looked at negatively in our culture as something pathological or something that's not very common, but I would say they're more common than not.
What are the most common fetishes that you see amongst your patients?
Definitely foot fetish. There's a very popular fetish. Others have to do with, certain acts. So certain domination submission acts, fetishes around lingerie or silky material. I think a fetish can be anything. I've seen some people fetish even role play activities and ideas.
So that would be considered a fetish as opposed to a fantasy?
Well, they kind of cross and cross in and go into the same territory, because usually fetish behavior is developed in a fantasy world. So a lot of people with a fetish may have never acted out that fetish before, so it's developed from a fantasy world. So then they want to explore that with a partner and need some help in communicating that to a partner, or feeling comfortable.
I was thinking about things that happen in people's childhood or formative years that affects their later sexuality. Certainly being shamed about something would fall into that category. But I was thinking about this concept of the talk, the sex talk, and how our parents present that for the first time. And I think one of the weaknesses of this whole concept of, the talk is that there's this expectation that in one sitting, you're going to explain everything that this child needs to know to launch into adolescence and adulthood, which is really impractical. We wouldn't do that with driving, or we wouldn't do that with taking care of your teeth, or, anything else that was safety, anything else that we have to teach our kids. I can't think of any other situation where we sit them down and we have one talk about it or one discussion. So one of the things I always advise parents is to start talking to kids about their sexuality and turning their phones off. See, we tell kids many times to turn their phones off. I always forget, but I always think it would be fun to kind of leave the phone on, and then whoever calls is in the conversation.
That's a good idea.
Yeah, like whoever that caller was, say, oh, hi, you've just dialed in to Dr. Donica and Dr. Shannon Chavez talking about sex talk and the talk and how you have that talk with your children. What's your advice?
Or what was your talk like?
Well, and do you ever ask people or find out from people that their talk that they had with their parents, and this is what I was getting at before the phone rang, actually gave them very negative conceptions about what sex is all about?
Yes, more often than not. And I think that's the piece that requires the most healing and normalizing around sex. And as you said, validating. I think for many people, I always say, their parents were not maybe given the talk themselves, so they weren't prepared to answer the questions or know what is appropriate to talk to their children. And I even have adult clients say, my children is developing in their sexuality and they're touching themselves, or, how do I talk to them about that? So I think even as a whole, we need to educate parents and educate everyone around how to talk about sex to young people. And that it's not
or not
we
just
be afraid of.
Yeah, or not so young people. We have our children are children, all the way through. And, many times, certainly my peers now are dealing with many of their children getting married and having the talk about marriage and relationships. Some of my friends have a little older children and they're already dealing with their children getting divorced, which of course brings up, lots of issues and lots of discussions. But what is your advice for parents doing, say, the first talk when their children are in middle school, say?
I would say start with the basics. Start with helping them understand their bodies, appropriate terms, as we said before, vulva, vagina, using
and that starts when they're preschoolers. That starts just when they're toilet training, using the proper terms for their genitals, or when they see you going to the bathroom and they ask you. One of the things that I always recommend to parents is whatever the question is, answer the question honestly, but you don't need to answer the question the way Wikipedia would answer the question. So for example, if a 5-year-old asks you where babies come from, all you have to say is they come out of mommy's uterus. And that's a fully perfect answer. You don't have to do a whole anatomy lesson or a whole sexuality lesson at 5 years old. But if somebody asks you where babies come from when they're 13, that's a more involved conversation. Or if they ask you when they're 26, that's a remedial conversation.
Exactly. Or what, I hear a lot of young kids coming home and they've heard things at school. And so I think they're going to be exposed to different sources and education to just normalize that. Yes, all right, this is something that just be comfortable talking about it yourself so your child does not feel embarrassed. I think the more comfortable you can feel, the more comfortable and confident your child is going to be, even bringing things up that may be questions or concerns that they have. So I think that's important too. Again, my mother was crying during the talk.
So are you the oldest sibling?
I am the youngest, and I'm the youngest daughter. So I think it was just, again, conservative family. So my mom didn't have the talk, and so she wasn't prepared. And I think I actually gave the talk more than she did. I gave the question, or I had the questions, and was giving a lot of the input that I was just sort of looking for the validation that was okay.
See, I don't even remember getting a talk. I don't know if I didn't or if I just blocked it out of my mind or if it didn't happen, but I'm the oldest sibling. So I remember giving the talk to my sister, who's 10 years younger than me. And so when I gave her the talk, I was already in medical school. And so I start talking to her, and I thought it would be easy to talk while I was driving. We were driving somewhere, and I thought, okay, this is a great opportunity. I have a captive audience. And I'm about, 5 minutes into it, and she bursts out, "Ew, disgusting. I hate having a gynecologist for a sister."
Oh, no.
So that was
not the reaction you were hoping for.
No. What are some of the tips that you give to adults who need to have some element of the talk with each other? or with their sexual partner or their not yet sexual partner. So
Right. I think one tip is to be direct. I think sometimes I call it sexual mad libs. So or charades, we're trying to, down there or here or there, just to be direct about where and what you're talking about and to use a language that you're comfortable with. I think there's a lot of terms that we hear and some people like different terms to describe their sexuality. There's no wrong or right in that, but find out what works for you and just make sure that your partner understands what you're referring to and what you're talking about. And that's really what the basis of all communication and relationship is about, understanding and being able to validate and be curious about someone else's perspective or experience. So being able to have the tools to do that, I think is probably the most important step.
And what about couples where one partner is more open and communicative than the other, and the other partner might be closed down or not interested in talking? So basically your average heterosexual couple.
I was going to say that's more common than not.
Male and female.
I think to be curious, but don't feel that you have to be the same. So, usually in relationships, we have different qualities that we're more comfortable or confident in. So if one's more comfortable in communication and the other is not to force that, but try to understand what it is that they are trying to communicate or what their needs are. Maybe they're better at showing you non-verbally. I try to teach couples to be more aware of nonverbal communication. So instead of asking, does that feel good? Is that what you want? Pay attention to what the body is doing. Is she or he moving in a certain way? What are the facial cues and expressions? So I think sometimes we get caught up in the verbal communication around pleasure where we just need to, again, focus and be mindful of what other communications that we're picking up on.
I remember a great scene from the Outlander book series, which I loved, where you have to have a little suspension of disbelief because a woman comes from a future time back into colonial times, and she's a doctor, and she's advising a young, about to be married young woman at a time when they never had sex and didn't know anything about sex before they got married. And she's asking for sexual advice. And the woman basically said, pay attention to what you're doing. And whenever he says, oh my God, keep doing that. And I just thought,
that's great.
That was the best sex advice ever. So along those lines, what's the best sex advice ever that you ever got?
Best sex advice was probably to take control of your own pleasure. So be responsible for your own orgasm. This idea that someone's going to give you an orgasm is just not the truth. You have to know what turns you on. You have to be responsible for your own orgasm. I think why that's great advice is that it gives you a sense of your own sexuality, and it's not the responsibility of a partner to turn you on, to make you feel good. I think that's very liberating advice because it kind of empowers you around your own pleasure. So it creates a different dynamic around sex, and I think that's definitely what we need. We need to feel more empowered around sex and participate in each other's pleasure rather than waiting for it to happen on its own.
You mean you're not allowed to just lie there and let it happen?
You may be lying there for a very long time.
I remember you talking about the importance of the words that we use. When I was a very new doctor, we were taught to ask people if they were sexually active. And that was the question. That was how it was phrased, to, get a consensus of, okay, which direction are we going with this exam or this history or whatever. And I remember this one woman who was about 40 said she was not sexually active. And I said, you're pregnant. How did this happen if you're not sexually active? She goes, oh, I just lie there. So I realized that, okay, maybe there was a problem with this term, are you sexually active? And then I also had patients react in an offended way when I would sometimes say that term again, because they interpreted it as sexually active meant promiscuous.
Interesting. That's a very good point. I remember on one of my assessment forms when I was working in a conservative Mormon population, I had have you ever had an erotic dream? And I remember there being a lot of questions around what is that? Even using the word erotic versus sexual and what that was. So I think there is definitely, it brought awareness to me as a clinician to be aware of how I'm languaging even the assessment of someone's sexuality so that they can be aware of that and not feel ashamed if they are not familiar with that. So I try to create a comfortable way for people to ask the questions, or, hey, what does this mean? I actually have a place in my assessment where they can check boxes of areas around sex that they're interested in learning more about. So it's giving them the terms and saying, oh, yeah, that is something maybe I've heard of, but I'm not that familiar with. So it kind of bridges that gap of feeling uncomfortable and asking the question, or being embarrassed around not knowing.
Mm-hmm. So what do you think is the most important thing most women need to know about sex therapy?
I think for women around sex therapy is that it is not a place to focus only on problems. I think what I do in sex therapy with women is try to empower them around their sexuality. And it's not just about what we're doing sexually. I like sexuality to be a part of, again, spirituality, who you are as a person. What are the things that excite you? Are you happy in your job and work? We're looking at all areas of life and integrating sexuality in a way that it can be seen as a part of wellness. So I think for women, it's a place to come and get great information, and it's a safe, comfortable space. And you may even leave with some toys or devices if you.
Well, we have, if you're wondering why I haven't asked you about that, we already have had a podcast episode with another sex therapist who talked about toys and devices. So, and she talked a lot about masturbation, both on your own and mutual masturbation within the context of a couple. So that was very interesting. So I recommend everybody go back and listen to that one. But before I let you go, of course, I could talk to you about this all day long. One of our traditional questions that we ask everybody, so you're not getting away without this, is what is the most unique, different, or unusual experience you ever had in the ladies' room, aside from this interview?
In the ladies' room, I've actually helped someone. I've given someone career advice in the ladies' room.
I thought that was going in a different way when you said help someone.
No, I actually have had some really great talks in the ladies' room. I feel like that's a place that women go and they feel comfortable. They're doing their makeup, they're fixing their hair, they're talking about life. So I do remember giving this woman some great career advice in the ladies' room, and there was a bonding moment. So I hope she's doing well. I didn't see her again, but it was a great conversation.
Well, and that gets to why we started this podcast in the ladies' room. That's the whole concept, is talking about things the way you and I would talk about them if we ran into each other in the ladies' room. So thank you for sharing all your great advice and your energy and your wisdom and your recommendations. And I hope if we get questions, I can send them to you and you can answer them. But I really appreciate it. And it was so great talking to you. Thank you. We're out of time, but please come back.
I will, absolutely.
Take care. Everybody, Dr. Shannon Chavez, and you can find her at drShannonChavez.com.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.